Hi, my name is Brianna. I'm 25 years old, and I am a mother to a almost 5-month-old baby girl. She was diagnosed with complete heart block, and I was diagnosed with either lupus or Sjogren's syndrome when her heart block was found. I'm going to do a trigger warning for this video. I don't want to obviously upset anybody. I will be talking about the low beats per minute for a baby with heart block, as well as potential infant loss. So if that upsets you, click away. I would also like to say that I'm not a doctor. This is our personal experience and our experience only. I do know that there are people out there with similar experiences, but this is very much our experience and our experience only. So I just wanted to say that. I'm also not a YouTuber. I'm very not great with technology, so I apologize if this video isn't, up to par, but this is the best I can do, and I just wanted to get our story out there. Because when I was pregnant, we did have a group on Facebook for families of children with complete heart block, and that definitely got me through my pregnancy. But as far as like story times, there wasn't much of anything. So this will be our experience, and I just wanted to put this out there to hopefully help somebody in our shoes in the future. So I'm kind of gonna go in order from the diagnosis through to my pregnancy, to the birth of my daughter, and like treatment for the heart block. Congenital heart disease is not curable. There are treatment options, but when you're diagnosed with something like this, you have it for life. There are options to, again, treat it, but it's never completely gone. So on November 25th, 2021, I went to my doctor. I was 21 weeks, 6 days pregnant. We had our anatomy scan on 20 weeks, and she looked great. Heartbeat was high. Structurally, her heart was good. Nothing was cause for concern, and that day my OB told me that. She got the report and said everything looks great. So everything looked good, like I said. She grabbed her fetal heart Doppler and was like, let's take a listen to your baby. I laid down, she checked her heartbeats, and it was like really weird sounding. Like it was almost kind of like it sounded like a really weird clapping noise. And then it was like about 65 beats per minute. Like it was really slow. And she's like, it could just be her position. We may not be getting the best reading, but just to be on the safe side, like, let's send you for more tests. So I was sent for an emergency ultrasound that morning. And then during my ultrasound, I lied back. They tested, or they were using their probe or whatever. And this girl kept calling more people in. And normally when they call more people, it's not a good thing. I kept hearing them use the term bradycardia or bradycardia. I can't remember how you say it. And then they called in a radiologist. He had to come in off his break because it was serious. So he came in, and then he looked at me after a while. It felt like forever. And he's like, you need to go back to your OB now. We're sending all this over to her. You need to go back to your doctor. So I called into work that day and I was like, I'm not coming in. I just initially had an appointment and it turned into a day-long disaster. But anyway, I called my doctor back, and she's actually not available because she was full of appointments that day. So she called me when she had a minute and was like, this is bad. Basically, she couldn't, I don't even really remember the phone call, to be honest. It was all over the place. And I felt very numb, and it was very surreal. So I just remember I just sat there crying. I didn't even know what she said. I just remember her saying, Doesn't matter what they find or diagnose you with, it's bad. You need to see a maternal fetal medicine specialist. I can no longer take care of you on my own. We need more in-depth specialists. So then I was sent to the maternal fetal medicine specialist in our city, or one of them, and he was pulled from the hospital to go to his clinic right away to meet us there. I went for, I think it would have been my third ultrasound of the day, and I just remember lying back and crying the entire time because I saw her moving and kicking, but her heart was really slow. Like, I remember watching her heartbeat and it didn't look like it did 2 weeks before. So I just like laid there and cried because I thought this was my last time that I was ever gonna see her. Like, I didn't know if I'd ever got a chance to see her on an ultrasound or if I'd ever meet her. Like, I wasn't sure if I was gonna have stillbirth or what was gonna go on. So that ended. Then the doctor reads scans, pulls us in, and he's like, okay, she has congenital heart disease. She has one of these 3 diseases. He said she either has a cardiomyopathy, an aortic stenosis, or she has complete heart block due to lupus or Sjogren's, SSA positive anti-hero antibodies. That one's a mouthful. So this third option, you need to go get your blood work done to see what it says. If your blood work comes back positive for abnormalities, we'll know that that's what this is. Also, you need to see a pediatric cardiologist. We have none where we live, so we had to wait for that office to call us at the Children's Hospital to let us go to their office so that they could give us a firm diagnosis, treatment plan, what to expect, yada, yada, yada. So that was a Thursday. I went to go get my blood work done. Didn't really think anything of it. I really, for some reason, didn't think it was going to be this autoimmune disease. So I kind of thought it was something else. And I went to bed and then basically waited until Monday because I couldn't get into the hospital. So it was a very sad weekend. I cried the entire time. I don't think I really ate anything. It was really sad. Whenever she'd kick me, I'd cry. I just felt like I would never hold her. So it was really hard. Monday finally came and we headed to Saskatoon to the Jim Pattison's Hospital, and we got a echocardiogram for my baby. So I didn't really know that they did this. They didn't for fetuses, but they do. So she had a very, very long ultrasound that day and a long echo, and the maternal fetal medicine specialist on call and the fetal cardiologist of the hospital and their nurses brought my husband and I into the consultation room and told us my blood work came back positive for an Anna screen and SSA antibodies. I tested negative for SSB antibodies. So I was then put in contact with a rheumatologist, and I'll get to that later. So we were told that she has complete heart block. I'm not really gonna get too much into the disease because I feel like I'll say something wrong. But basically there's no communication between the chambers of the heart. They beat at separate times. And that's, the very much watered down gist of what it is from a non-medical professional. Anyway, so we were then kind of given the option to continue on with the pregnancy, and I obviously did. This is a risk every time I get pregnant because it's just my blood. It's something in my blood that attacks the baby's heart. So you can be put on preventative medication, which is called hydroxychloroquine. I'm not a doctor, but it can help the risk of it happening. But because this had already happened, there was nothing I could do about it. It was just to continue keeping her stable from where she was at the time. So I was prescribed hydroxychloroquine, but that was more for my symptoms. It wasn't for her. It wasn't going to do anything for her. I was also placed on dexamethasone, and I'll get a little bit into dexamethasone a little bit later and my experience on the steroids. So because my daughter had complete heart block, and there is no cure, like I said, there are treatments, and the treatment for complete heart block is a pacemaker. Typically, if you have stage 1 or stage 2 of heart block, you can kind of make it without a pacemaker. Most cases with complete heart block, they need a pacemaker. Not everybody gets them. It all depends on a case-by-case basis. Everyone's different. But because of where she was at the time, they were like, she's probably going to need one right after birth, if not the first few weeks of life. So you need to give birth in Edmonton at the Royal Alec Hospital, and then they'll take her to the Stollery and she'll have NICU time. And then they'll kind of see where she's at. But because she has complete heart block, if she did need to get rushed into surgery, she needed to be there. So we relocated to Edmonton when I was 36 weeks pregnant, because in case I went into labor, I needed to be there. So they typically, where I live, don't want mothers who have a baby with complete heart block to go into labor, because of the irregular heartbeat already. They have no way of seeing if the baby's in distress. So, and that does put a lot of stress on a baby. So they typically wanted me to be there. If I had any signs of labor, it was going to be an emergency C-section. And if not, just a regular scheduled one, which is what happened with me. So we got the news, and then I had basically the rest of my pregnancy to not know if she would make it to the end of the pregnancy. And I was also in the very heights of like the Omicron variant where I lived. So I was homebodied, didn't leave the house. It was hard because nobody really knew what I was going through. I am a younger mom, so even a lot of my friends don't even have kids, and I have no friends with kids with medical conditions, so that was also difficult. I really had nobody to relate to, so they were able to put me in contact with 2 other moms who have reported cases of lupus or Sjogren's causing heart block to their babies within the last few years, so that was great. Honestly, if I didn't have them, I don't know what I would have done. My pregnancy was hard. It was very, very hard on me mentally, my body, my baby, obviously, my husband. So without them, I don't know if I would have made it. We'll talk a little bit about the medications that I was on, specifically dexamethasone. If you don't know, dexamethasone is a steroid, and the reason I was prescribed it was to keep her heart from decomposing. It's literally what the doctor used, the term. So, yeah. Dexamethasone causes severe insomnia. I was lucky if I got 3 to 4 hours of sleep a night. There were days I think I went close to, I think, 48 hours without sleep. And for a pregnant mother, that's difficult. I was exhausted. My body was still trying to, give nutrients to my daughter. And then I had this drug that physically would not let me rest. And that's all I needed. It's all I wanted. I was so tired, but my brain wouldn't go to bed. It wouldn't let me rest. So it really felt like I was on Adderall. And I was on that for 10 weeks. And I had to slowly wean myself off when I got through the critical period. And they typically say the critical period for lupus or Sjogren's causing heart block is between 18 to 25 weeks. So when I had found the heart block, she was already 22 weeks. I needed to get through the rest of kind of the second trimester, beginning of third trimester, before I could come off of them. And also you can't just stop steroids cold turkey. You will go into shock because your body stops creating natural steroids when you start taking artificial steroids. So you need to slowly wean yourself off so your body can start creating cortisol naturally again. So that was difficult too. So honestly, the pregnancy, once you're on steroids, it's hard. A lot of women gain a ton of weight because it makes you crave more carbs and sugar than you probably already would when you're pregnant. I'm in a heart block group on Facebook, and one of the moms I was put in contact with, or not put in contact with, we had started communicating from the group, and she had said she gained, I think, close to 60 to 80 pounds when she started the steroids. So definitely causes a lot of weight gain. Luckily, I didn't really have a ton of that. I was really craving like guacamole and like really cold kind of fruit and stuff like that. So that was helpful. So as far as monitoring her went, it was daily. I had a fetal heart Doppler at home. I checked her 3 times a day. I also had to go to the fetal assessment unit in my hospital where I lived, and she was monitored daily, her heart rate, and weekly she had an echo. Once she was kind of through the critical period, the doctor in Saskatoon would call me every week after her echo. He'd get the scan sent to him, and he's like, okay, she's good to go. You can kind of push it off. Every few days you can go to the hospital to get her heart rate checked, and every 2 weeks you can go to get an echo. So once she started kind of to get through week by week, she was more stable, was able to go less, we were able to go to the doctor less. And because I was at the hospital every day for the month of December anyways, I just went on EI. I stopped going to work and went on sick leave because I couldn't do it. It was a lot, especially being on steroids with not sleeping. I just could not manage my day-to-day job, and I knew that. So I just decided to go on EI, and I'm really glad that I did. It was very lonely because I really just had my husband. Sorry, my baby's crying in the back. My baby's behind me, and she woke up. So anyway, I got through to, we surpassed the critical period. And then it was time to start planning the birth. So we were set up to stay at the Ronald McDonald house. So I got there at the beginning of March. We stayed the entire month. And Aurora was born, that's her name, Aurora. She was born on, I think I was 37 weeks, 3 days is when we did the C-section. And then, so the C-section itself was very clinical. Because of her heart condition, I had to give birth at a hospital. She was taken to a completely other, separate hospital. So I did not get to hold her. I didn't get to do skin to skin. They took her out, took her to a stabilization room beside us. My husband was able to take some pictures. And then once they got her kind of going, I guess her blood flow wasn't great. So they were kind of trying to get her stable enough where she could transport to another hospital. So when I was done with my surgery, they wheeled me to a recovery area, and then they wheeled my baby up to me in this kind of incubator, travel incubator. And so I got to see her for 2 minutes, and then she was gone. And I didn't get to see her for almost 2 days, a day and a half. Then my husband went with them because I was like, just go be with our baby. I can do it by myself. Because I was delivering somewhere else, and we were during a pandemic, so visitation was very limited on hospitals. I was by myself, and I didn't have any family with me. So my husband went and kind of took turns, he'd spend time with my baby and then he'd come see me. So anyway, the next day came and they were like, you're good to go. You've passed all your tests post-op. You can either stay the night and leave in the morning, or you can leave now. And I'm like, I'm going to see my baby. I'm not sitting here if I can leave. So my husband picks me up. We go to the hospital. And so she was stable at that point. So the next morning, when they do rounds in a NICU, it's pretty crazy. So there's a bunch of people wheeled in their laptops on the stand. There was probably like 10 or 12 people that came into our room with these big computers. And they're like, okay, so she so far does not need to be paced, but she can't eat. So she was very much dependent on IVs and vitamins. She worked her way up over the course of the 2 weeks up to eating, but it was hard for her. So electrophysiology, those are the doctors that implant pacemakers. They monitored her closely and did 24-hour Holter monitors on her. So that measures all your beats, basically everything kind of your heart does, I think, over a 24-hour period. And they review it and then kind of tell you if there were any pauses. That's kind of a big thing that they look for. If the heart has a pause of like, I think they said longer than 3 seconds, don't quote me on that, that's an indication for a pacemaker, to just keep the heart regulating. And so they said that she had a couple of them, but they weren't long enough to pace her. So they wanted to keep her for a while to monitor her before they, just because we weren't nearby, we lived in another province, they wanted to make sure that we were really good to go home. So she stayed for 2 weeks, and then we got the green light to leave and we left. We drove all the way back to Saskatchewan, and we have been stable ever since. She has an appointment at the Stollery at the end of this month to get another Holter monitor done, and then we will see what that says, and hopefully we're still, don't need to be paced yet, because they want to hold off as long as they can until they're older. There's more room to put a pacemaker in and less risk for an infection. So as for me, with my lupus diagnosis, they basically, at first it was I was leaning more towards the Sjogren's syndrome symptoms with like dry mouth, dry eyes, but I was also pregnant, and I think that was more so pregnancy, because once I gave birth, all of that stopped. And I've been more so like achy, I get a rash on my face. So now I'm leaning more towards the lupus side. So my rheumatologist and I have both just kind of been like, okay, like it's probably lupus, because I was having all of those symptoms while I was pregnant too. But a key thing for Sjogren's is dry eyes, dry mouth, and I've kind of lost that after giving birth. So I definitely think it's just I was just really dry and dehydrated while I was pregnant. I honestly wasn't drinking enough water too. So anyway, so that was basically my pregnancy through to the birth of my daughter. It was long, definitely hard. I don't know if I could do it again, to be quite honest with you. It was very mentally and physically draining and exhausting, trying to keep hope, but also trying to prepare myself mentally if something were to happen and I wasn't able to take her home. Because unfortunately, there are people that don't get to with this diagnosis. Some babies go into complete heart failure and don't make it. So that's just kind of the real about this diagnosis. Unfortunately, that's just how it is. But I am grateful that I was able to take my daughter home and that she's still hanging on strong without a pacemaker. I do hope that this video is helpful to somebody in the future. I'm going to post this in my heart block group as well, because I know that there are new moms that every day that get diagnosed with this or with a kid with heart block. So if you have any questions about heart block or lupus causing heart block, autoimmune diseases while you're pregnant, anything like that, I can try and answer those in down below. But thank you for watching and listening to our story. But yeah, if you have any questions at all, just let me know. And yeah, thanks.